Hello doctors, welcome back. Following the lecture series of the muscles of upper limb, in this video lecture we will discuss the anatomy of the muscles of the anterior compartment of the forearm region. Student, the muscles of the forearm regions are divided into three layers: superficial layer, intermediate layer, and the deep layer. The muscles of these superficial layers are the pronator teres muscle, flexor carpi radialis muscle, palmaris longis muscle, and the flexor carpi ulnaris muscles. Student, first we will discuss the flexor carpi ulnaris muscle, which is one of the muscles of the superficial group of the anterior compartment of the forearm region. So this is the flexor carpi ulnaris muscle. Student, the flexor carpi ulnaris muscle has two heads: the humeral head, which originates from the medial epicondyle of the humerus bone, and the ulnar head, which originates from the olecranon process of the ulna and the posterior surface of the ulna bone. We have discussed the olecranon process in the anatomy of the ulna bone. Student, the flexor carpi ulnaris muscle originate and run inferiorly and insert on the pisiform bone of the carpal. This is the pisiform bone, and it also insert on the hook process of the hamate bone. This is the hook process of the hamate bone, and also to the base of the fifth metacarpal bone. This is the fifth metacarpal bone. This is the base of the fifth metacarpal bone. This is the shaft of the fifth metacarpal bone, while this is the head. So the flexor carpi ulnaris muscle insert on the pisiform bone, hook of the hamate bone, and the base of the fifth metacarpal bone. The proper insertion is not shown in the diagram. Now student, moving toward the blood supply of the flexor carpi ulnaris muscle. So the flexor carpi ulnaris muscle is mainly supplied by the ulnar artery. This is the ulnar artery, which is the branch of the brachial artery. Flexor carpi ulnaris muscle is also supplied by the posterior recurrent ulnar artery. This is the posterior ulnar recurrent artery. This is the branch of the ulnar artery. Now student, moving toward the innervation of the flexor carpi ulnaris muscle. So the flexor carpi ulnaris muscle is innervated by the ulnar nerve. This is the ulnar nerve, and the ulnar nerve originates from the medial cord of the brachial plexus. Now student, moving toward the actions of the flexor carpi ulnaris muscle. So this muscle play important role in the flexion of the hand at the wrist joint, and it also play important role in the adduction of the hand at the wrist joint. Now student, as we have discussed the anatomy of the flexor carpi ulnaris muscle, so here we will overview this muscle. As we have discussed, it has two heads: the humeral head, which originates from the medial epicondyle of the humerus bone; the ulnar head. The ulnar head originates from the olecranon process and the posterior border of the ulna bone. Now student, this muscle run inferiorly and insert on the pisiform bone, the hook of the hamate bone, and the base of the fifth metacarpal bone. The action of the flexor carpi ulnaris muscle is the flexion and adduction of the hand at the wrist joint. The flexor carpi ulnaris muscle is supplied by the ulnar artery and the posterior ulnar recurrent artery, which is also the branch of the ulnar artery, while the ulnar artery is the branch of the brachial artery. The innervation of the flexor carpi ulnaris muscle is the ulnar nerve. The ulnar nerve originates from the medial cord of the brachial plexus. Now student, moving toward the another muscle of the anterior compartment of the forearm, which is the palmaris longus muscle. Student, the palmaris longus muscle originates from the medial epicondyle of the humerus bone. This is the medial epicondyle of the humerus bone. This muscle originates and run inferiorly and laterally and passes under the flexor retinaculum. This is the flexor retinaculum, which is not shown in the diagram. And this muscle insert on the palmar aponeurosis. This region, this is the palmar aponeurosis. Student, the palmar aponeurosis is the continuation of the tendon, and this insert into the deep fascia of the palm region. Now moving toward the blood supply of the palmaris longus muscle. Student, the palmaris longus muscle is supplied by the ulnar artery. The ulnar artery is the branch of the brachial artery. Here this is the brachial artery, and it give branch to the ulnar artery at the cubital fossa region. This region is the cubital fossa region. Now moving toward the innervation of the palmaris longus muscle. This muscle is innervated by the median nerve. This is the median nerve. The median nerve originates from the medial and the lateral cord of the brachial plexus. Now moving toward the action of the palmaris longus muscle. So this muscle play an important role in the flexion of the hand. Now student, as we have studied the anatomy of the palmaris longus muscle, we will overview this muscle. As this muscle originates from the medial epicondyle of the humerus bone, and it runs inferiorly and laterally and passes under the flexor retinaculum and insert on the palmar aponeurosis. The action of the palmaris longus muscle is it plays an important role in the flexion of the hand, and it is supplied by the ulnar artery and innervated by the median nerve. Student, the median nerve originates from the medial and the lateral cord of the brachial plexus. Now student, moving toward the another muscle of the anterior compartment of the forearm, the flexor carpi radialis muscle. This is the flexor carpi radialis muscle. Student, the flexor carpi radialis muscle originates from the medial epicondyle of the humerus bone. This is the medial epicondyle of the humerus bone. This muscle runs inferiorly and laterally, and it inserts on the base of the second and third metacarpal bones. These are the metacarpal bones. This is the first metacarpal bone. This is the second metacarpal bone, third, fourth, and fifth. So this muscle insert on the base of the second and third metacarpal bone. It is not shown in the diagram, but it insert on the second and the third metacarpal bone. Now student, moving toward the blood supply of the flexor carpi radialis muscle. So this muscle is supplied by the ulnar artery. This is the ulnar artery, which is the branch of the brachial artery, and it is also supplied by the posterior ulnar recurrent artery. This is the posterior ulnar recurrent artery. Now student, moving toward the innervation of the flexor carpi radialis muscle. This muscle is innervated by the median nerve. This is the median nerve. The median nerve, student, originates from the medial and the lateral cord of the brachial plexus. Now student, moving toward the action of the flexor carpi radialis muscle. So this muscle play important role in the flexion of the hand at the wrist region or the wrist joint, and it also play important role in the adduction of the hand at the wrist joint. Now student, moving toward another muscle of the anterior compartment of the forearm region, which is the pronator teres muscle. This is the pronator teres muscle. Student, this muscle originates from the medial epicondyle of the humerus bone and also from the coronoid process. This is the coronoid process. We have studied this in the osteology of the ulnar bone. So this muscle has two heads, the ulnar head, which originates from the coronoid process, and the humeral head, which originates from the epicondyle of the humerus bone. So this muscle runs inferiorly and laterally, and this muscle insert on the posterior side of the radius bone. Here, as you can see, this muscle originates in this way, run inferiorly and laterally, and it move around the posterior surface of the radius bone and insert on the shaft of the posterior surface of the radius bone. Now student, moving toward the blood supply of the pronator teres muscle. So this muscle is supplied by the anterior ulnar recurrent artery. This is the anterior ulnar recurrent artery, which is the branch of the ulnar artery. And student, this muscle is also supplied by the inferior ulnar collateral artery. This is the inferior ulnar collateral artery, and this is the branch of the brachial artery. Now student, the innervation of the pronator teres muscle is, this muscle is innervated by the median nerve. This is the median nerve. Student, the median nerve arises from the medial and the lateral cord of the brachial plexus. Now student, the action of the pronator teres muscle is it plays an important role in the pronation and the flexion of the forearm. Now student, as we have studied the anatomy of the pronator teres muscle, so we will review this muscle as it has two heads, the humeral head and the ulnar head. The humeral head originates from the medial epicondyle, while the ulnar head originates from the medial border of the coronoid process. This muscle runs inferiorly and laterally and insert on the lateral side of the shaft of the radius bone. The action of the pronator teres muscle is the pronation and the flexion of the forearm. This muscle is supplied by the inferior ulnar collateral artery, which is the branch of the brachial artery, and also it is supplied by the anterior ulnar recurrent artery, which is the branch of the ulnar artery. Student, this muscle is innervated by the median nerve. The median nerve originates from the medial and the lateral cord of the brachial plexus.